Let's go ahead and start.
All right, it's Tuesday, May 12th, 2020. This is issues. Start with roll call. Chair Bernard.
Here.
Commissioner Schrader.
Here.
Commissioner Savas.
Here.
Commissioner Fisher.
Here.
Commissioner Humberston.
Here.
All commissioners are present. We will begin with coronavirus update with Nancy Bush, Director of Disaster Management, Incident Commander of the Emergency Operations Center, and then we have several specific updates to provide you after her general update. So go ahead, Nancy.
All right, thank you. So looking at our numbers, here in Oregon, we have 3,286 positives, 130 deaths, and 77,542 negatives. Clackamas County now has 268 positives, which is an increase of 18 over the weekend. And we have 9 deaths now, which is one additional death, and 7,178 negatives. Multnomah County has 899 positives. They have 53 deaths and 16,446 negatives. Washington County has 587 positives, 13 deaths, 10,583 negatives. Right now in the state, we have 59 that are confirmed positives that are hospitalized. So a couple things going on here this week. I just wanted to mention and let you guys know that the KN95 mask that we now have are now restricted to be used only for cloth face coverings. The FDA reversed a ruling that they had where they said that we could use the KN95s for medical personnel. That is no longer true. So we have several KN95 masks that we will figure out how we're going to use them and where we're going to send those. We had to get back those that we had sent out. So we were lucky we did not have that many sent out, and those that were sent out were not sent to any medical staff for use. So we had a couple of days of scrambling and trying to get all of that worked out. So we continue to work. I know we're going to talk a little bit more on reopening, but we're working on anticipating our PPE needs for EMS facilities and working on a formula that we think is pretty, a really good formula. And we've really been working on that and how we push things out to our EMS communities anyway. So we already had something in place that was pretty strong for us to work on. Public Health is investigating 2 long-term care facility outbreaks, which I believe started over the weekend, which is probably why we saw that 18 increase over the weekend as well. And we're training some new staff right now from OHSU and environmental health staff that's going to be working on contact tracing issues. And we brought on about 8 people this week to do that. Some of them are not full-time, but we're working on that and making sure that we're getting that up and running as quickly as we can. And we continue to work on the food boxes and the food insecurities. We are going to be having food drives, I believe, in Sandy and at the Clackamas Town Center this week, and continuing to work with other communities to see how we can get food out to those that have food insecurities. We continue to offer showers for those populations that are houseless, and we now have worked with a facility in West Lynn to provide some showers. We're working, of course, in Oregon City as well as Milwaukee and Moala, and the service center, the Clackamas Service Center. So I think I'll stop there for now as my overall review of what's going on here in the EOC. If there's questions about that, please let me know.
Questions?
I have a question. So why did the CDC change its reasons for the K95 masks?
And it wasn't the CDC, it was the FDA.
The FDA, why was that?
So from what I understand and from what I've been reading, they found them to be of poor, it was of lesser quality than what was expected for the microbes that we're concerned about.
Okay.
Commissioner Savas?
Yeah, I just want to, 2 things. Just want to confirm that we're going to have some opportunity to talk about the situation and I didn't want to interrupt the flow of the presentation of both either Nancy and or Dr. President. So wanted to confirm that. And secondly, for maybe there's a way, not that it's necessary today, but there's different types of N95 mask, and you're typically talking about the K. And, you know, I have bought those kinds of masks for my business for years, and there's 3 pages in my catalog of one supplier of different masks that most people would look at one glance and say they're all the same, and they're not. And most all of them are N95 rated. So there's all different types. When we talk about K versus this, I know that maybe people that are listening or watching may not understand that, but and I think, Nancy, you're just saying it's a quality issue. It's not necessarily a type issue.
That's my understanding. There are certain, and Dr. President might want to weigh in on this too, since she actually uses N95s. But there are certain brands that they said that we can use, I think like 3M. But if they're not certain brands, we cannot use them for an N95.
Yeah, I'll just chime in that the criteria for medical grade N95 is not, N95 has to do with the filtration level of the mask itself. When you're talking about medical grade, you need to look at like moisture and particular pathogens as well. And a lot of that has to do with how well it actually fits the face, not the filtration itself. And my understanding, and so there is a very specific way that masks are approved for the medical grade in the United States. And my understanding was that these KN95s were acceptable on an emergency use and further evaluation of them. They are not sure that the fit is consistent enough to be approved for medical use across our country.
So we have an hour and a half, and we can dig into the medical use of masks, or just take for what it is. We have some that we can't use, and move on to the more important issue is how and when does Clackamas County open for business? At least how and when do we put in the application to the governor? So that's the next subject, right?
Yes, it is, Chair. So next I'll ask Nancy, and I'll help her, work with her to discuss with you Clackamas County's application to the governor for Phase 1 reopening. We sent to you, Commissioners, last Friday a timeline of how Clackamas County is meeting the prerequisites that the governor has set as part of the application process. That's also posted online for the public to view. We want to kind of walk you through that, how staff feels we are at meeting those prerequisites, and get a draft application to you as soon as possible, but we'll talk about that as well. So Nancy, if I could let you kick that off, please.
Yeah, so thank you. So there's a couple of things that have been going on and actually came up even overnight. And one of them is that the governor does have a new website where it has a lot of information there. Some of it I found is a little bit contradictory from what we've been hearing and seeing in other places. So I just kind of want to go over that just for a minute. So some of the things that we have to have here are the number of people with new COVID-19 infections has dropped for 2 weeks, or there's less than 5 COVID-19 hospitalizations here in the county. So I will say that at one point, they were talking about the region, but now what I'm reading on the website, it says it's per county, and I'm not sure if Dr. President knows more about that, but that literally popped up overnight, and we're taking a look at that and to see what it means for us. We are working with our hospitals and to see here in the county and getting letters from them saying that they are ready and they have PPE and they have the staffing that they need, as well as the rooms that they need. So that's something that's a moving target, and we are working with the state on that. So some of the other timelines that we're going to be talking about too is the testing. And we did take a look yesterday to see how much testing we're currently doing. And we actually have met the testing goal that has been set for the county per week, and how many we have to test per week. We still need to talk about how we're going to test the underserved communities. And we're going to be working with our EMS community on that, and hopefully do some contracts there. And that's a conversation we're actually having with through our Fire Defense Board on Thursday, to see how they would like to do that and how if they could help us out with that. Contact tracing, as I mentioned a little bit earlier, we are currently bringing people on, or we are training current staff that we have that can step in and be contact tracers. I believe those of you who are on the call with the governor on Friday, she has said that we could phase that in. We still need to make sure that whatever we send in to the governor in the plan says that, you know, we can do the contact tracing according to the guidelines. And if we need to bring more on, we need to have a plan in place to do that. And that would be part of the plan to how we could ramp that up. So that is underway. And just be aware too, as we bring contact tracers on, they still have to be trained, which does take a period of time to get that done too. The personal protective equipment, we have been looking at that. Just as I mentioned too, we've been working with our EMS community. We've been trying to determine, you know, how much we need to have in stock here in order to meet the governor's guidelines, and see if that supply chain is being opened up and if it's being stabilized. We still are having Tyvek suits and gowns seem to be more difficult to get. And we are working with some of the other counties here in the region to see if we can put in a order that is larger, to see if we can get those into the region so that we all have that ready to go. Let me see. The readiness to for the social support for those who may need to be, or that would be in quarantine for up to 2 weeks. So there's a team that we have to put together that makes sure that those individuals, we're calling them caseworkers, make sure they have food or have access to food. Do they need medications, you know, and what do they need if they're in their homes and can't go outside of their homes, and if their entire family is also quarantined. So that's also a piece that we are putting together that has to be a part of the plan. So we are right now working on the plan. We have one that's in very rough draft, and we would continue to work on that and put the pieces together as our public health staff bring those to us, and we have those conversations. Our goal is to have a rough draft to you by the end of the week. Yeah, you know, by the end of the day Friday, so that can be sent to you to take a look at for conversations in the next week. And I think I will stop there to see if there are questions or if Gary has anything he would like to add.
Yes, I'll just add, you know, commissioners, obviously you have heard from the community, as have I, as have all of us, about the sense of urgency of moving forward on this as efficiently as possible, while also knowing, as you know, we allow science and our health professionals to help guide us on when Clackamas County is ready to meet these prerequisites as set by the governor. So you will see a draft of the application by the end of this week for your review next week. I am hoping that you may have the information you need to make a submission next week. But again, I don't want to make a commitment that we have to change, because then that confuses the public. So staff is doing their part to get you the information you need by the end of this week for you to have a discussion next week.
Oh, go ahead.
As of yesterday afternoon, 32 of the 36 counties had submitted applications to the state. And it was pointed out on the news last night that the only counties that have not submitted an application was Clackamas, Washington, Multnomah, and Lincoln County. I spent literally the whole weekend and yesterday talking to folks that have lots of questions, and because of the confusion on Thursday's announcement and all the subsequent discussion and conflicting information, there's just a lot of concern out there. And really, I think we're at a point now where I think we have really another state of emergency, and that's an economic state of emergency. We ought to be considering having a resolution to recognize every day that goes on, every day or every delay that goes by, it's impacting Clackamas County substantially, and our constituents, whether they're families or their employees or their business owners or all the above. So it seems to me that we ought to be as ready as possible. And what I got from the governor's call with their staff on Friday was that you don't necessarily have to meet all these prerequisites so much as having a plan or a timeline in which you can meet them. And by reading, I didn't read them all, and by reading some of the similar sized counties that have submitted, like Lane County, for example, and Marion County, reading their applications, they seem to have worked tirelessly throughout the weekend, apparently, and have quite a bit submitted. So I don't know how much of what our level of completion of the application is, Nancy, or Gary, but how far along are we? And you know, are we 75% complete?
So, you know, you're restating what we hear every day is businesses want to open. And our staff worked all weekend long. But like they said on the media, we have a larger population and are in a health region. So let me just tell you that you're going to Friday get a draft. The goal is to us to review it, and on Tuesday, perhaps I put in an application on the 22nd. We're hoping, but remember, we're part of a region, and that means the other 6 also have to be ready. If I'm incorrect on that, Nancy, let me know. But the governor's call did clear up a lot of stuff. I can tell you a lot of stuff, but whether we as a region are ready, I don't know. But our goal is to submit an application on the 22nd.
Well, Jim, you kind of cut me off, but I was trying to pose a question and make sure it was framed up accurately. I think I covered all the points you were trying to make, and being careful about the question and recognizing where we were. I just asked for our level of completion.
So, yeah, I know that the things that we're talking about are the things that I just said that we're working on. I mean, I'm not sure I can give you a level of completion because there's so many other parts that we have to be put in here. We have the document is put together. We have, you know, the index, and we know, you know, what is going where, and we're building each of those out as we move forward and we work with our public health staff. So, I mean, yeah, I mean, and we did work this weekend as well and trying to make sure, you know, that we could get something to you by the end of the week. And I will say, Chair Bernard, as well, that the health system readiness is a regional approach. The other pieces are county pieces that we are putting together.
Yeah, I didn't mean to infer that no one was working on the weekend. So I apologize if that was the message that was conveyed.
Ken, you had your hand up?
Yeah, I've been conveying this information out to several thousand people via Facebook, and I've only had a few people basically go completely sideways on this. And I am communicating it to different business groups and whatnot like that. I think it has helped that we can do retail as of Friday. I've sent the link out so that people can, that literally 7,000 to 8,000 people are getting this. They can go to that link, find out exactly what the standards are to open up their retail. And I've also let them know that we are working as hard and as fast as we can for the next step, phase 1, for restaurants, bars, etc. And as I get information, I provide that to people. So while there's some people out there that'll never be satisfied until everything is open and back to the way it used to be, and just basically some people who want to be angry about this whole thing, most people are pretty understanding about it. At the same time, I get the desperation that people in business feel. But I remind them that we don't have the authority to just blanket open things up, that the authority rests in the governor's offices and with our medical people. And we're going to follow those protocols. Again, 90+%, probably 95% people are trying to work with us and go forward. Very few are particularly negative about it. So I just say let's do everything we can as safely as we can and as quickly as we can. I think the timeline that Commissioner Bernard mentioned is good. And hopefully on Tuesday, we will be able to say, yes, we're good to go and submit.
I have Commissioner Fisher and then Commissioner Schrader.
Thank you. And I really appreciate all the work that's gone into this. I am still confused, even though I keep looking at it and I've read these things a million times and I've listened to the governor and Nancy, you may have already said this, but what I'm confused about is which parts are regional and which parts do we as a county have to do, and can counties within a region open at different times? Just some of those questions. I'm thinking I'm getting it by looking at the document that you provided. But if you could just tell me, even if we want to walk through this document, it says reopening prerequisites, and I have contact tracing, decreasing prevalence, and hospital admissions. I'm thinking those are for the health region, and then underneath that is county. Is that correct?
So no, the contact tracing and the testing and that belongs to the county. Okay. So the health system and the PPE partially belongs to the county and partially belongs to the health system. Okay. So for us, we have to manage, our PPE here and for our EMS and make sure that they either have supply or we have some supply. And then the hospitals say that they have to have enough PPE depending on the size of the hospital, either for 30 days or 60 days. I'm sorry, 30 days or 15 days, 2 weeks, 4 weeks. And then our public health data is, and looking at the rate of the cases and then working with the hospitals to see how many admissions they have had that are COVID. That's kind of a joint effort. Okay. So, and yes, we can, let's say Columbia County in our region, we keep picking on Columbia County, it seems like in our calls, but Columbia County may not be ready to open, but we can open as long as we have the health system readiness and the county is ready. So we don't have to wait for everyone in the region.
Commissioner Schrader?
So there has been some confusion about retail opening up on the 15th, is my understanding. Can I get some clarity on that? Because we were told by Rihanna at Regional Solutions that they could, and then I've heard, no, that's not really so.
Yeah, so I think Commissioner Hubbardson has that answer.
Yeah, so what's going on with that?
Okay, I specifically called Rihanna after the meeting a couple hours later to get clarity on that issue, and I got a specific answer, and the specific answer was that retail outlets that are not in malls, so these are things like furniture stores and jewelry store, that kind of a thing, even a clothing store, can open on May 15th, and they have to follow the protocols that are listed under retail, and that's a link that the businesses can go to, and it shows them exactly what the protocols are that they have to follow. It does not include restaurants, bars, personal services, things like salons and barbershops and nail salons and those kinds of things. Only retail outlets not in malls.
So all the little mom and pop stores can open on the 15th?
If they're selling stuff, yes.
And they follow the guidelines.
And they follow the guidelines.
Okay. There was some confusion as to whether or not that was so. So thank you.
That's why I made that phone call, because there was that confusion, and so I just called the governor's office and she gave me a specific answer.
Dr. President wants to get in here.
I'm sorry. I had a couple of thoughts and comments that I wanted to add that are not about the retail. Is now an okay time to just add on? I just want to bring up that the three Portland metro counties, Clackamas, Washington, and Multnomah together have about 55% of the state's cases right now, and at least 2/3 of the state's hospitalizations. And so when we have the highest population density. And I just really want to make sure that we all keep that perspective of we are kind of at the highest risk of rebound surge with reopening because of the prevalence of disease in this area and our population. So when we are, the last region to be able to open, there are, it's because of these things. And I just want to, I know the need to reopen for our economy is huge. And if we go too fast before we're ready to help control that surge, then we're going to have to close down again if the surge is too big. The contact tracing is up to the county, yes, and we have plans around increasing staffing and training. We are still waiting on a data management system from OHA. So we have a data management system but with the magnitude of cases and contacts in our region, that system is not going to tolerate that. And so that's one thing that we're waiting, whereas the smaller counties with fewer cases may be able to manage better with the system we currently have. The technology for the magnitude of cases and case investigations and contact controlled, we have some technology things that we're waiting on as well. And testing, we have the testing numbers, but really the outreach to those vulnerable populations or the outbreaks and being able to get the testing to the right place. I just want to kind of reiterate how complicated that is in such a diverse county that we have and such a large land size that we have to reach all. Be sure that we have access in all areas of our county. So thank you for letting me pipe in. I like to just put my perspective in a little bit. Thanks.
I'm a little worried already. Nancy mentioned we had a little bit of uptick over the weekend, and
Yep.
we could get an uptick that would knock us out next week.
And I think that as people, as the weather's getting nice, as people are hearing about retail opening, as people are hearing about the state opening, our social distancing measures, I imagine people are going to start sort of loosening their behaviors on their own. And I think that watching how in the next few weeks our cases do go is really an important part of when we are truly ready to fully go into phase one of the reopening. I think that there's a lot of behavior change already that we need to see how that's managed, how that's affecting things.
You have Commissioner Savas, Commissioner Humberston, and then Commissioner Fisher.
Okay.
Yeah, in my earlier comments, I mentioned Lane County and Marion County, and I mentioned them because they're similar sized. Lane County's 382,000, Marion County's 348,000. So they're similar sized counties. Marion County's contiguous to us. They have a very high rate of cases, greater than ours. And frankly, on a daily basis, their numbers are higher than ours. Lane County is just the opposite. They have really, really low numbers. So I thought that was a good balance of looking at or comparing their applications and how they're coping with it. So I recognize all those things, and I am not suggesting we veer or do anything contrary to the governor's guidelines. That's not, obviously I'm trying to suggest that we work as timely as possible within those timelines and within those guidelines of the governor's phase one opening. So and momentarily I'd like to go back, and if staff could help me or point or send to me by email the document, because when Rihanna spoke yesterday with regard to retail, she said that there would be an announcement or a document forthcoming. I looked all through the website throughout the day. I could not find one. The most recent document that spoke to retail on the lower right corner had May 9th date on it. So, and it spoke to retail, but if someone could send that to me, I appreciate Commissioner Humberston's information and his diligence in reaching out to Rihanna. But I think sending some of these businesses or clearing this confusion up with a document from the state is the best solid way to do that. So
Nan-
please point me.
Nancy, did you have something?
Yeah, I just want to say, yeah, the link was actually in an email that Gary did send you this morning that had the HPO, the hospital, the situation report, and it was down in the body of Denise's information, but we can resend that. And I also just wanted to add too, that, you know, even if we do have a plan ready to go to be submitted next week, doesn't mean that we're asking to be open on the 23rd. It would be a plan. That may be a date into the future as well. I just want to make sure that that's understood not only by the commissioners, but also by the public. So even if we do get it in, and I'll say too, that I know that there's a lot of plans in to the governor. That doesn't mean they're being approved.
Right.
And we haven't heard anything yet on what has been approved or what has not. So I just want to also just bring that up as well.
Who was it? Commissioner Fisher?
Humberston, and then Commissioner Fisher.
Okay, Humberston, Ken.
Yeah, I just want to confirm that I understand one aspect accurately. My understanding in terms of surge capacity is that our ability to manage the surge capacity has to include the populations of the other 3 counties, Columbia, Tillamook, Clatsop, some of whom don't have their own hospitals. Their people will come to our hospitals here in either Clackamas, Washington, or Multnomah. So when we're looking at surge capacity, it's for that entire region. Am I correct on that?
Yes. Yeah.
Okay.
President, yes.
I thought that was the case. I want to be sure. It's not just localized for us, unfortunately.
It's not just the tri-counties. That's correct.
Yeah.
Commissioner
Thank you.
Fisher. Sonia?
Yeah, thanks. I have 2 questions. I'll ask my first question. I've heard from 2 different elected officials who are also healthcare providers, Commissioner Sharon Myron and Rachel Prusak, that there's still a concern that on the ground, healthcare providers don't have the PPE that they need. And I'm just curious, I know that hospitals need to attest that they have the PPE, but are there any built-in safeguards or mechanisms to make sure that the frontline workers do have the PPE? That's my first question.
So I know, Dr. President, do you have anything on that? Or, I mean, I know that we're relying on, so we're getting data in regionally every week on what the hospitals say that they have. So we we work with them, but we have to trust them. They're saying that yes, they do, no, they don't, or we still need Tyvek suits or whatever. So and I know that the data I've been reading and looking at, I think that they're being very upfront with what they have and what they do not have. The raw data I'm looking at. I hope that helps, but.
Yeah. It's just keeps coming up over and over and over again in all of my conversations. The next question that I have, so we are now seeing there are reports out of China and different areas that have reopened that they're spiking again. And I'm just wondering, how are we studying what is happening with these economies that are opening up? And how is our plan different, or how are we trying to mitigate what negative consequences they've had?
I think the only thing, I think what the governor is really trying to do is really looking at science and saying, how do we open? And one of the things I know she mentioned last week was, she did say some of the smaller counties might be able to open that don't have cases or few cases. So from what I am seeing and hearing is that looking at this very scientifically, trying to look at the spread, the population density, as you know, Dr. President mentioned a little bit earlier. Yeah, I don't know, Dr. President, if you have anything you want to add to that.
Well, I think we anticipate a surge when we reopen. We don't have a vaccine, we don't have treatment. So we know that as people interact more, then the disease will spread. And the goal is to be able to do that intensive contact tracing and isolate and quarantine people so that they, if they are ill, if they are contagious, they are not spreading it. And that is really where the massive increase in public health staffing in order to do that, but also where we really need the cooperation of the public. We talk about how a public health response is 10% the public health department and 90% the community, following our recommendations and doing the right thing. And so I think that just really keeping the communication to the public that we're not out of the woods, that the disease is still there, that we still need to be safe, we still need to be practicing the social distancing measures in order to safely open, then hopefully we will manage the surge that there is. But all of these criteria of the contact tracers and the testing capabilities is so that the identification and containment of the spots where the disease can be done. And that's why it's going to take us a little while to get to where we think that we're able to do that.
So another question that I have, we do know scientifically that certain masks prevent people from getting the virus as well as spreading the virus. Why is it that we aren't investing in building our supply of the masks that we know that would contain the virus instead of building the capacity to deal with people after they have acquired the virus?
I can't speak to the global supply chain issues on a local level. What I can speak to is sort of infection control measures have 3 levels. We have environmental controls, we have engineering controls, and we have personal controls. And so what I and our public health department have control over are sort of some of these environmental control type things, which is what identification and containment are. The personal controls around mask use and the public using masks and where we get those. I think that we need to keep looking towards the state and the feds to help with that.
We have Commissioner Savas, then Commissioner Schrader.
One thing I think, Nancy, when you're opening up with your presentation this morning, I think you mentioned, or maybe it was Dr. President, about a recent outbreak maybe in a care facility or congregate care. And something that has come up in the conversations in the last few days is that should we be parsing out those numbers, at least from an analytic basis, and to make sure that if there's, let's say, an outbreak at a care facility and there's like a number in the neighborhood of 20 or 30 in one day, that doesn't change the complexion of how we're doing in the rest of the county, right? Because our population is so large. So I had Emily, she just sent it to me, just do a breakdown of what how Clackamas County is doing per capita. So just basically taking the population and then just doing the math against our number of cases. And we actually rank pretty low. We're not the lowest, but we rank pretty low. And our neighboring counties are ranking a lot higher than we are. So I think we got to recognize what we're doing well and how we're doing it. But it's also, I know like Lynn County had an outbreak, and that was at a care facility, for a veterans facility, I believe. So I think that analytics would help us kind of better gauge how we're doing. And I'm just concerned that maybe that's not a measurement that in the governor's guidelines or prerequisites as being parsed out particularly.
I think that's important. I think, Oregon Health Authority put out zip code data recently, which has a lot of those similar issues where you might have a high number in a certain zip code because it's a long-term care facility or because it's a work site with an outbreak. And I don't know, we'd have to ask I'd have to go back to the data teams around what we can, access and present as far as long-term care facility or not, but I do know that the state is also posting the long-term care facilities that have pending or confirmed tests. Our county so far has, knock on wood, only had 2 outbreaks in long-term care facilities. We've had a few suspect cases, but only 2 outbreaks, and they're actually quite small. So I can tell you that in our numbers, the long-term care facility outbreak is not a significant part. How we can present that on an ongoing basis, we'll have to talk about and figure out. I'm not sure what the answer to that is right now, but we'll look into it.
Right. I guess I'm really trying to pave the way for a question that not today, but soon, when we look at when we open or how the state views our application as far as our readiness to open it, when it comes to the first prerequisite, you know, the declining prevalence of COVID-19. And it seems to me, again, that if we are doing all the social distancing and we're taking all these precautions and we're doing a good job and there's an outbreak in a care facility, that we're not bogged down or, I won't say penalized, but we're not allowed to open because of that. And actually a further question is that if our numbers continue to do well and our neighboring counties are not, and obviously Tillamook County and Clackamas County are in our region, their numbers are looking pretty good, far better than ours. You know, our neighboring counties, whether it's Marion County to the south or whether it's Multnomah County to the north, don't stop us from opening if we can do so safely. And I think I want to put that, you know, if we can do so safely. I know that the commute shed is huge. I mean, it goes from Clark County, you know, probably easily into Marion County. But I think that right now there's a little bit of question being asked, why aren't the three tri-county regions applying or have an application? And you answered that. I'm not questioning that, but we got to deal with the perception of why we are not. And I just want to put that out there for just public messaging. People are asking the question, why not? Sometime today, if we could maybe put together some kind of, not necessarily a news release, but a talking point to that effect, so we can explain what we're doing and why, and so that people aren't reading into that more than what it is. So I'll stop there.
Well, I think the answer is pretty simple. Our population's higher, therefore we need more tracers. We need more PPEs in the region. In Clackamas County, not as much as Multnomah County does, but again, we're in a health region. So that alone makes it more complicated. Like I said, the governor cleared up a lot of issues on her phone call. We thought we were going to have 70 people employed at the county. And the question was, who pays for that? And her answer was, I will. And also for the training. And you heard me ask, what about our share of the money? The other counties got over 100 million each, and we didn't. So how about our percentage? And she straightened that out and said, sorry, that's the federal government's decision. But those 2 things alone is the reason why we take longer. And we have been working on this ever since we heard from the governor what our requirements were. So it's not like we've been sitting back. Everyone works really hard. And I know we have some contracts we're working on and some training and folks to bring in, but we need a certain percentage in the office. And I believe you said that was maybe 30, somewhere around 30. Right, Nancy?
Yeah, that is talking to our disease specialists and those that are working with contact tracing. We were hoping that with 30 FTEs would be able to help us. That's what we're thinking at this point. That is correct.
How long is the training?
I don't know if Dr. President knows that. I don't know that.
Yeah, so I think that there are different sort of modules that people can have to go through the basics. I would say to go through all of the material, you know, into a tightly packed day. You could read through everything in a day, probably. There's training on the computer system, which takes a while. But then actually putting it into practice and understanding the nuances and when the questions come up, how to actually to perform the work. So currently with our new folks, we'll have them do a day, probably like 2 to 3 days with somebody who's a veteran contact tracer, so that they learn the ropes. But it takes a good 2 weeks to really be kind of up and running and independent, because there are so many different aspects to the work. And so just learning all the information in a day is not totally reasonable. But the folks that we've brought on, I think about 2 weeks, then they seem pretty independent.
So how many do we have on staff now?
Well, they're not all full-time. So about 8, I think we have about 11 currently working, but they're not all full-time, so I can't give you an FTE right now.
Yeah,
I
had we had 12, but as Dr. President said, they're not all full-time. They're not FTEs. Yeah.
We have Commissioner Schrader, Commissioner Fisher, and Commissioner Humberston. Martha, you're on mute.
I have a question about the testing capabilities. Right now, we're only testing people who are showing signs and who are sick. How are we going to gear up? What's the process to do the testing for the entire population? Are you going to have drive-by testing? Do they have enough tests for that? Are we still going to limit the number of people that we test? I mean, if you really don't have the capacity to test the entire population, how are you going to do the contact tracing? So how's that going to work?
Yeah, so at this point, we don't have plans to test the entire population.
Okay.
If we were to do that, we need to be very clear that having a negative test doesn't mean it's not going to come up positive tomorrow. And so
Right.
to be a way of using that for control, it would have to be on a regular basis. We would test the entire population. I do think that anybody who's symptomatic can get a test now. And then for the asymptomatic people, we're focusing on the outbreaks. So, for example, a long-term care facility has a handful of cases and 150 residents and staff. That's where we would go and test everybody who's in a facility that we know that they're spread. And then working on the manpower to actually collect those tests is something we're actively working with. I think Nancy mentioned our discussions with EMS and Fire Council, and trying to find the bodies who can actually go places. For people who have transportation themselves, who can get to a provider's office and they have symptoms, everybody should be able to get tested now. And then as far as the asymptomatic, we're focusing on the outbreak control in those pockets where we find that there is disease.
Okay,
Does that answer?
Yeah, it does. But basically, we still have the danger, it seems to me, of having all those asymptomatic people, unless they're working in a long-term care facility or some kind of an other situation like that, that could be still continually spreading the virus. Is that a correct assumption?
It is, which is why as we move into phase 1, we all need to be maintaining the social distancing measures.
Okay.
Going into the businesses that are opening, there is absolutely still that risk.
Okay,
and we need to plan for that.
And then for Paul, I'd love to get that per capita information if you could get that to us. So thank you, Dr. President.
Tanya.
Yeah, a couple other questions. Paul made me think about this, and also Chair Bernard. So right now in our region, we are under the same stay home, save lives order that the governor provided. except there are a couple things that have happened. Retail is going to be opening, and there's also, I read in the Oregonian today that you can recreate within 50, you shouldn't go farther than 50 miles from your home. Is there any other changes that have happened? People really think they can go recreate with friends, go to the, go hang out at the river, go to the park and hang out with, do a picnic with people, do those kinds of things. I'm just wanting to make sure I've got it straight.
That has not changed. Nothing else has changed other than medical non-urgent procedures. That's another change where more people are going to medical providers of various sorts. But the social distancing recommendations and the recreation outdoors has not changed.
So I gotta be honest. I totally thought that we had to get through our regional health thing first before businesses opened. I was totally surprised to see that wasn't necessarily true.
Yeah, the retail piece, I think, was a surprise to all of us. And I think even Gary said at one point that the governor's material actually had two different things on it. They were contradictory. So until Commissioner Hubbardson actually called and, said, is this what it really is? We didn't know it either. So I don't think that was communicated very well.
Yeah.
But it's definitely on the website now.
Yeah. Ken.
Yeah, I just sent an email a few minutes ago to all of the county commissioners. It's the one I got from Laura Edmonds yesterday. She worked through and pulled out all the phase 1 guideline links, as well as the COVID-19 website in a single email. So if you want to know what the standards are for retail, for instance, you click on retail, it takes you to the appropriate site. The only thing I'll tell you about that is it may call retail part of phase 1. That's incorrect. It's phase 0, basically. But those are the standards for retail. If you click on restaurants, bars, breweries, tasting rooms, and distilleries, those will be the standards for those businesses when we get to phase 1, but not until. And of course, all of them are subject to change. But at least now you have that information. You can share that information with business people that you know, so they can prepare their own plans for when the time comes that they can actually open up their establishments.
Have we reviewed her email and make sure there wasn't some error in it? Gary, didn't you mention that she might have mistaken one of your statements?
I made a statement at the chamber event yesterday that staff will have by the end of this week a draft application to the commissioners. And I read the email that the county may submit an application to the governor this week, which, as you just discussed, is not going to happen.
Yeah.
Okay.
Commissioner Savas.
I don't want to add another layer of confusion. Thank you, Ken, for sending me that link. So I saw it, I read it. If you look at the date in the lower right corner, it's date April 7th. And it does say phase 1. And then the document that I referenced earlier in my conversation, I just sent to Gary, along with a picture of part of the website where I found it. And it is dated May 9th. And it basically is phase 0 because it says effective May 15th. Not any phase, period, flat statewide is effective. And that link says that retail can open. There's no calling out thereof. And if staff could just help clarify this, because a lot of people that are listening right now and a lot of people that will listen to this tape later on, I want to make sure that we are a accurate resource for the right information. So what I'm reading on the document dated May 9th is that retail can open, mall or otherwise. So Gary, could you task someone to verify that? I sent you what I found on the state website.
Yep, I just forwarded it to all the commissioners right now.
Nancy, did you have something?
No, I was just going to say too that Stephen sent the link out to the governor's page that came up last night, which has the guidance on there and also has the retail stores. But Stephen also sent that link to everyone.
And does it say anything about malls? I think it says single standing or so.
Yeah, they have their own entrance, I believe.
So are we all talking about the same link? It'd be helpful if you shared among yourselves, if you send it to me too.
Yeah.
Well, yours is probably the most recent one since you got it last night.
Well, it's the one I found to be the most informative and helpful. And I agree with Nancy that a lot of the information coming from Salem has been slightly contradictory. But it's important to note that, as I point out in the email, is that retail per se in its entirety was never really closed down. Home Depot, Bi-Mart, liquor stores, auto stores, Wilco, Coastal, they've all been open. You've had art galleries, museums, furniture stores, boutiques, cosmetic stores. You've had identified blocks of retail that were closed down by way of the governor's order. My interpretation is consistent, I think, with Commissioner Savis's, is that retail on the 15th, provided you maintain social distancing, can be open. But my only area of uncertainty has been with malls. I think malls are still shut down. I haven't seen the distinction yet, though, where outdoor versus indoor malls, like the outlet center down in Woodburn versus Lloyd Center. I'm not entirely sure where they stand.
Well, my guess is if they have a single entrance, let's say J.C. Penney's used to have a single entrance, you would shut off the one that goes into the mall and folks would come in that door and then that store would be open.
So
Go
what-
ahead,
the
Dr. Fritz.
presentation says standalone retail that was previously closed but can adhere by OSHA guidelines, including furniture stores, art gallery, jewelry stores, and boutiques. That was what was in the presentation that the governor gave.
That's why it still leaves on some uncertainty as opposed to malls, but we can get clarity on that.
There's a document on the Oregon Health Authority website that is specific guidance for shopping centers and malls. Is that that was just posted. It says it's dated the 9th, but I just saw it yesterday. And it says shopping center and malls must keep any common area settings such as food courts and seating areas configured to support at least 6 feet distance. Determine maximum occupancy within the shopping center or mall to maintain at least a 6 feet physical distancing and limit admittance accordingly. And post signs at entrances, exits, etc. So it's a one-page document that's on the OHA, and I put a link to that. But it's not from the governor's office; it's from the OHA. So
yeah, and that's exactly the language that I found and consistent with that. So basically, as I read it and as Rihanna said it yesterday, things like jewelry stores and malls actually can open provided they follow these guidelines effective May 15th. And it states that clearly in the heading on the OHA website that Stephen just sent us, which I sent you a copy of. There's literally a block on that page that clearly says guidance that applies statewide starting May 15th, 2020. And it says, and there's a link that says employers and a link that says retail stores. You click on that and there's the document.
So we should put that on our webpage and just ask people to refer to that document. It's not necessary. I mean, it's still a lot of confusion. You go one place, you get one thing, one place, you get the other. But I think the Oregon Health Authority is what the governor looks to.
The reference to malls, though, does say phase 1. It says guidance that only applies to counties that enter phase 1. Restaurants, bars, personal services providers, malls, and gyms with a parenthetical guidance forthcoming. So that's why there's still some doubt. I think we might need to be phase 1 before those services can open. But that's the one area of uncertainty right now for me.
But that's dated May 7th.
Well, that's current. I'm on their site right now.
Hurston?
Just going to say, I would suggest you check with the governor's office, because when I called Rihanna on the phone, it was very specific. Malls were not included for retail opening.
That's what
Period.
this says. And this is
So-
dated tonight.
It is single standing retail stores. So if there's confusion in two different sites, I would call the governor's office or Rihanna's office and get a specific answer to that question. But that was what she told me yesterday.
Why don't we get somebody to do that right now?
Please.
Maybe we could, before we end this meeting,
Good
get
idea.
people to the exact site. Because man, if I'm sitting out there listening to this, I'd be really confused. And I see Dr. Present has a site up, HTTPS, oops, went away. Maybe we could put that up. But is that the final answer? We need somebody on the phone calling the governor's office. We got 29 minutes.
I will
You got
ask
it?
one of the policy advisors to do that.
Okay. Boy, I'm running to the mall and get me a mattress or something. Well, you know, you probably got your notes from last night's meeting with the chairs. I tell you, I am a little confused on where the other counties are going. And all I can tell you is that we've decided that our goal, I want to stress something. It's our goal is to apply on the 22nd. And then how long the governor takes, we don't know. And then whether she's going to make us be tied into the other counties, we're not sure. So that's our goal. And I don't get the impression that Multnomah County is quite there yet. I would say that Washington County's closer, very similar to us, but that could all change today, by the way, because they're all Washington County and ourselves are meeting today. And the board will decide. We're deciding next Tuesday whether we like what we see.
You have Commissioner Savis?
Yeah, so Jim, don't take this as an argument. Don't take it as a criticism. I'm not meaning it like that whatsoever, but things get so confusing. I think the clarification is important. I did too read the minutes from that, and I was like, wait a minute. It says that there's agreement or a decision to do this together, and then I'm looking at the website and I'm seeing that half those counties already applied. And then when you say, again, I'm not challenging this, so take this constructively. I'm just asking for clarification. We say we decide, or we decided. I'm just want to get clarification that number one, if that's we decided as maybe the Multnomah County and Washington County and Clackamas County chairs, that's not a binding decision per se, or maybe it was a consensus. I'm just kind of get clarification, because our role as a Board of County Commissioners to our elected constituents is much different than three chairs or a majority of those three chairs that aren't elected by the constituents of Clackamas County, for example. So
our goal was to try to open together. That is not necessarily what is going to occur. I would say that depending upon Washington County's discussion today, ours today, we probably have the same goal of putting in an application next week. But like Catherine said, she's not sure what her board's opinion is going to be. And I felt fairly comfortable about ours. But if we're going to put in the application, if the governor says you guys got to all be ready to go, that's a different story. We're going to have our application in. Just because it's in doesn't mean we're going to open, like Nancy said earlier. And then if they're a week late or or the same time, and the governor says, well, you guys go ahead and open, and you guys haven't got your application in, we're going to follow the governor's decision. So no, it's not a written agreement that we're going to open together. My impression is that Washington County and Clackamas County are probably further ahead than Multnomah County, but they have a lot bigger population. So we'll see what the governor says when we put our application in. The other counties, by the way, in this region may have put in their application, and the governor, if we hear the governor say, go ahead and open, then that's going to give us some feel for what she's going to say when we do it. But we are much more tied than Tillamook, Columbia, or Clatsop.
Well, thank you for taking that in the constructive way it was meant, and take this in the constructive way it was meant. I think we need to make sure we convey that we are not going to disadvantage our constituents because of another. And I think that's what you said. So I just think it's important for us to say and clarify that we want to do so in as safely as possible. And in our conversation we had during the chamber thing yesterday morning with Commissioner Schrader and Commissioner Humberston is that, you know, I made the statement that we need to make sure that when we open, we're not going to see a spike or resurgence that really sets us back and takes a lot of resources, maybe that some businesses and employees and everyone else has investing in that effort to reopen, be all for naught and have those resources being lost and to take a step backwards. We need to make sure that we're moving forward and we're all looking out for one another's interest. So thank you.
Yeah, but and you're right, and that's our goal. We're not going to disadvantage Clackamas County because the others, but we're listening to our Dr. President, and we're listening to Nancy Bush and her team, as well as the RDPO health folks on, I wouldn't be able to say we're going to open and not see a spike. My guess is we're going to open and see a spike. And that scares me. The biggest, I don't know if you read Don Krupp's posting this morning, but on again, off again, on again, off again is a likely scenario. And that scares me. It scares me. I hope he's wrong. Nancy or Dr. President, anything else?
And I know that Dr. President has said in the past too, it's like when we do open things up, we are going to see more cases. And, I think that, we have to prepare ourselves for that. I think that what we need to try to do the best we can is to have, like you said, Chair Bernard, is try to keep from going back and forth and opening and not opening, but prepare ourselves that yes, there are going to be more cases because that's just the way it's going to be. Yeah. And trying to work on those scenarios of surge and those things that the governor has asked us to do.
Ken?
Yeah, I think the point of having the PPE and the bed capacity and all that is to manage an anticipated surge.
Yeah.
That is precisely the point.
Yeah.
The level of the surge is obviously the critical issue, and if it overwhelms our capacity, then we do yo-yo back into lockdown, and nobody wants to see that. So it's being able to manage that surge. And then I pulled up both of those pages, Paul, just so you know, and as far as I can tell, even though the date at the bottom is 2 days different, the pages are identical for retail. So, but I still say that it's probably a good idea to call the governor's office and make sure that we absolutely clarify that malls are not included, or they are, one or the other. But my understanding is they are not.
As I conveyed, and I think Commissioner Humberson had used a word I'll reuse today, or a phrase. So what I was trying to convey yesterday to the chamber is that we need to do this all together. We're all in this together, and we need to make sure that we are the employees, the constituents, our customers, that the businesses, that we need to work together on this. Yep. And I think Commissioner Humberson's phrase that I liked was it is a social contract of sorts, and that we realize that we're all in this together, and we all need to work together to reopen Clackamas County as safely as possible.
Yeah, because if we do it wrong, we don't do our separation and our masks and stuff, and we end up back in this, it's going to be much more painful. and deadly. So what do we want to do next? Are we done talking, Gary?
So this topic originally was to give you an update on the county's application to the governor for phase 1. So what I'm hearing is you agree to our plan, staff's recommendation. You will get a draft copy of the application by the end of this Friday for you to review this weekend. And next Tuesday, 1 week from today at your work session, you will discuss it and potentially approve it. So that is our plan, unless you tell me otherwise right now.
Commissioner Fisher?
Yeah, Gary, I had a question before you said that. I don't have a comment on that. I had one other question based on what Chair Bernard had just summarized. I'm curious, what are the enforcement mechanisms if people don't follow the rules of social distancing and the things that we need to keep this virus at bay?
Can I respond to that, Mr. Chairman?
Sure.
Because that question came up the other day, and it basically the resources that the sheriff's department have and our code enforcement people have are limited even under the best of circumstances in terms of how much they can respond to. So much of this is going to be on the voluntary compliance, the social contract aspect of this on the part of all of us as a society. There'll be egregious cases that probably the sheriff's department or code enforcement could handle, but they're going to be few and far between in all candidness. It's really incumbent upon the business community in particular and us to get the message out that the more we don't follow the rules, the greater the risk of going backwards. So let's, keep your hands clean, use your mask, keep the social distancing, understand that we are, as Paul said, we're all in this together. But enforcement's going to be a tough road to hoe because we just don't have those kinds of resources.
Well, I don't know if you saw the Seaside story this weekend. The police kicked 700 people. Maybe it was Cannon Beach.
Cannon Beach.
Yeah, 700 people out of town. And the next day, 60. So at some point, the cities are going to have to do some of that. They're where most of the stuff is. But, it's going to, like he said, I think Ken's absolutely right. It's a social contract. And society itself is going to have to manage this. Martha, you want to say something? Your mic's not on. No? Anyway.
So I just had a response from Caroline she was unable to get a hold of Rihanna, but she talked to the governor's executive assistant. Her understanding is that malls are closed, but if there is a store that can provide outside entrance, such as a Barnes & Noble at the town center, and can follow the established guidelines, then they are able to open on Friday. The executive assistant is sending a message to Rihanna and will keep Caroline updated if that information is incorrect.
So we can double check at the afternoon session, but that's my understanding too. In other words, the mall entrance would not be open. The outside entrance would be open.
To a specific store.
Yes, to a specific store.
Gotcha.
So is JCPenney still there? I don't know.
I don't know.
I don't go to the mall. But JCPenney, Sears, I think Sears is gone. Meyer Franks.
I think Nordstrom is closing down too, actually.
So Meyer Franks would be open if they shut the mall entrance. And that's my favorite store. Not that I'm promoting Franks or anything. Macy's. Wait, it's called Macy's.
Well, and a big thank you to Caroline for scrambling and getting that information for us.
Great.
Yeah, the state's going to have to update that one link and just put some language in there that says about that mall call out, and then it will help clear things up.
Yeah.
Anything else on this issue? Doesn't look like it. Gary, what do you want to do here?
All right, next, commissioners, I'm going to ask for your permission to extend the temporary closure of most county buildings for an additional 2 weeks until June 1st. Your prior decision expires on Monday. So I'm using the caveat of most because some are actually open to some members of the public, such as our clerk's office. At a limited basis, members of the public have been allowed in. Our justice court is going to open a little bit for some members of the public for some cases this weekend. So I'm saying the caveat, most county buildings, primarily the development services building and public services building, to allow staff to continue to prepare for the time when we can allow the public back in. We are still providing services to the public. It's remotely though. So I'm asking your permission to extend the temporary closure of most buildings until June 1st. We'll be really clear on the website exactly what is open and what isn't. And there's all phone numbers and emails listed so the public can check to confirm. But I am asking your permission to extend it an additional 2 weeks.
What do you guys think? Up? Down? You said that that's to the public, but the building could be open to staff.
It already has been, and yes, each department is required to fill out a form of how that they can ensure employee safety in the office. So we have slowly been allowing more staff to come back into county buildings to work. And that is a rolling process that has been going on now for 2 weeks and will expand even more in the next 2 weeks. So yes, employees are back, some employees back in buildings. If employees are allowed to continue working remotely, it's working for the employee and the department, and we're not minimizing public services, then those employees can continue to work remotely. The key is to ensure we're giving services, still providing services to the public, and I believe that that is occurring.
So Ken?
Just a couple of quick questions. Would we really anticipate opening on June 1st is my first question, and is staff on the maintenance crew putting in the appropriate shields and things of that nature, whether there's direct customer service opportunities going forward?
I do not think that we will open as we did as of March 17th. We will not be 100% back to normal. That will take time. Staff is working on preparing for allowing the public back into our customer service center areas, but we're not prepared as of right now. We may not be prepared in 2 weeks, but I'll have more information for you in the coming days as staff is preparing for that.
I just want to be sure that when we do finally say, okay, everybody can come on back to work, that we have the appropriate shields in place and all that kind of stuff, so we minimize the risk to our people. And frankly, also minimizing the risk the other way towards the citizens who come in to avail themselves of our services.
Absolutely, Commissioner, yes.
Thank you.
Commissioner Savas?
Yeah, Gary, on this topic, just because of a couple inquiries in the last few days on a couple different departments, which I won't name because I haven't validated it. I know that staffs, some departments have done a just outstanding job, and we actually got compliments from some people as far as the access and the improvements during this crisis. So could we just make sure that double check that every service counter, door, department, so forth, whether it's internet access or whether it's phone access or whether it's a posting on the door of where that department is, that there's adequate information to be reached. I will talk with you later or send you something later, forward you the messages I got about 2 different departments and some challenges, but I don't know if that's mistakenly or just one of those 3 mechanisms. Again, the internet, the phone, or the door. Thank you.
Absolutely. Share with me what you have, because that was my expectation, and I believe departments are meeting that the public has access, whether it's phone, email, or otherwise, that we are not stopping services. But I will follow up on that. Thank you.
So Nancy, I sent you an email, a doctor's office sent me just a little bit ago. Can you tell me about doctor's offices for doctor present?
In what that being open, you mean?
Yes. So this is I think it's like did you see that email? I sent it to you.
Oh,
I know you can't. You got 5 things going.
Yeah.
Last name's Hanson. They have
I just opened it.
Okay. Take a look at that. It's a facility, I believe, in Westland, and it is a doctor's office where they do Botox, whatever, all that.
Okay. Yeah. I will have to do some research on this unless Dr. Present has information, because I don't think they're considered medical, Dr. Present.
Yeah, I don't know the details of that email, but medical offices, there's a medical spa, which is separate from medical care in the governor's orders. And there's personal services versus medical care. And so some places are in kind of a gray area there, and I understand that. But medical offices have never needed to close. The ability to reopen or restart non-emergent procedures, it's still the guidance is still to protect your high-risk population as much as possible, encourage telemedicine as much as possible. The elderly community, try to keep them home as much as you can to not expose them. Make sure you have PPE for your employees, and then try to limit the procedures you have to what's urgent and decreasing amounts compared to what's normal. So there are the order to stop all non-urgent procedures is ended, but all the other guidance of how to safely care for the public is still valid.
So could you send that to Dr. Present and somebody respond to her?
Yeah, I just sent it to Dr. Present. So
Okay.
we'll take care of it.
Because it almost sounds like it's more of what you would describe as a medical spa.
Mm-hmm.
I'm not sure.
Yeah.
Okay, great.
So do I have your approval to extend the temporary closure of most county buildings until June 1st? I'm seeing thumbs up. All right, thank you, commissioners. I do propose we end this at 11:30, and we'll continue issues in the afternoon, but I'd like to do two more very quickly. First is, I sent you an email, commissioners, on Friday. Maybe it was Thursday, I've lost track. I signed a contract on your behalf under the COVID-19 emergency declaration. It was for Do Good Multnomah to provide shelter for individuals affected by COVID-19. It is a hotel voucher program. The amount is for $450,000. The revenue is from a federal grant, an emergency solutions grant. That is the funding source, not the general fund. I forwarded you the documents. They're online for the public to look at. I'm seeking your ratification of that contract I signed on your behalf.
I thought this came up already, and we had this questions, where'd the money come from? I thought Paul asked that. And so we were okay on it, as far as I know. So thumbs up on that.
Well, I have a question.
Okay.
And Gary, thank you for replying and responding to my question. Though I'm not challenging what your answer is, just like the earlier discussion about the malls, things are confusing and we're getting mixed information or mixed messages. I think, and I think you said it last week, let's just presume that federal funding doesn't qualify. We've got a means. I think you said think that federal funding or aid or whatever stimulus money, that those dollars never come. I hope that there's a means within H3S to fill that.
So I'll ask for Nancy's help. I believe we've already received the grant, so we already have the funds in hand. Nancy, can you confirm that?
So we have received the letter for the award, and the money is supposed to be here by the end of the month. And we have those two. The ESGCV is, we have talked to finance, and they have made the contact, and we're supposed to have the money by the end of the month.
Yeah, and of course, just for anyone who's listening, my question was, or concern was, after listening to the FEMA federal webinar that was 2 Fridays ago that I participated in, the federal government was making it very clear that, for example, if someone was stricken with COVID and they had a documented case, they were eligible for some kind of temporary housing, whatever it may be, such as a motel or whatnot, and monies could be used for that. But they went out of their way, and I think it was a question that it came up from someone else, that because it was talking about the CARES Act, they were talking about 3 or 4 federal funding streams in that conversation, and someone made the distinction, well, if we house people that are vulnerable to or susceptible to COVID or perhaps death to a COVID infection, and we take preventative steps, will federal funding cover that? And the answer was no. So I'm not challenging anyone. I'm just saying we just need to be cautious that if that turns out to be the case, then we're prepared to not backfill, but figure out how we're going to cover that cost.
So the cost, I will say, I mean, I've had 2 people look at this, that it can be used for rent assistance for tenants, housing stabilization, fund for landlord, homeless shelter services, and purchasing homeless services supplies for COVID. So that's pretty open.
Yeah, and I would not look to H3S for backfilling anything. They're really worried. They have a huge cut and unstable funding from the federal government and the state. So I had an opportunity to talk to Richard yesterday. He's quite concerned. So we're not going to make a mistake, right?
Multiple departments are concerned, Chair Bernard. So I guess first I do need a ratification or not. If you don't want to go forward, we can undo it. But I need a vote, please. Ask for a
Yeah.
vote.
Oh, so please poll us.
Is there a motion?
Yeah,
So
I
moved.
move. Yeah,
In second?
aye,
I'll second.
Okay.
all of us.
Okay. Commissioner Schrader,
Aye.
Commissioner Fisher,
Aye.
Commissioner Humberston,
Aye.
Commissioner Savas,
All right.
Chair Bernard.
Aye, motion carries unanimously. Thank you.
Thank
for
you.
polling.
And then I guess the takeaway I'm hearing, Nancy, is that maybe we should wait till the money's in hand before we move forward on contracts like this as best as we can.
Yes.
This is an urgent situation, but Commissioner Savas raises an excellent point. Okay,
Okay.
let's do one more, commissioners, before we break for the morning. And that is Mike Bondi from the Oregon State University Extension Service, who would like to give a quick update on the status of the Education Center project building that has been in planning for quite a while. And he wants to tell you what the plans are at this point in time. So Mike is coming into the session here. And there he is. If you can unmute yourself, Mike, and then please go ahead.
All right. Yes. Thank you very much. Appreciate everybody's time today. And I won't take a lot of time. Clearly, you have much more important business these days than what I need to talk to you about. And obviously, these are crazy times for all of us. And I do appreciate the time on the agenda. I'm here to really share the latest information about the Extension Education Center. I know that's something you're all very familiar with, and what have been our plans, hopes, and dreams to bring this building to the Red Soils campus. And as you probably know now, the project has been put on pause. I guess to some extent, I'd say this project is a casualty of COVID-19, certainly not the entire case. This was, of course, for me, it was not an easy decision to make, and I appreciate the help of folks here in the county in administration that helped me work through this. It does seem like the project, as I reflect back on it, had its share of bumps along the road. We finally did go to bid last February 13th after what seemed like years of talking, planning, and working on the project. Our closing date was set about 6 weeks out, and as it turned out, hit kind of right when the whole COVID thing was really getting, getting pretty serious. And we ended up extending the bid process or the bid closure twice, once around spring break because of some conflicts for the contractors, and then secondly, due to the emerging COVID crisis. When we finally did close on April 9th, we began obviously checking all of the bid details and really taking a much closer look at the real cost of the project, which couldn't be ascertained, of course, until you had the bids. The apparent low bid came in about $800,000 higher than we had hoped and what our projections were. the original plans were kind of all along to probably need to borrow between $6 and $7 million to finance a project. And I looked at projected cost of that financing back last October, November with county finance folks. But as it turned out, and we started looking at the bond sale, working with you on a bond sale, it looked like the actual cost that we were going to need to borrow was probably running closer to 7.5 to even 8.5 million. Driven not only by the cost of construction, I should say, or increased cost of construction, but also the projected cost of the financing was considerably different than and the debt service than what we looked at in the fall. And then additionally, something that I did not anticipate was securing the debt, another 20% on top of the debt service to secure the debt. And then, of course, on top of it all, I guess, to be very honest with you, was a potential slump in the economy, talk of recession, depression, whatever, potential impacts on tax revenues for the district. And really kind of one of the other big things for us was a hope to raise a certain amount of the money privately with donations. And of course, the donation business is not real good right now. You know, you kind of look at all that, all those factors combined created what I'd say was kind of the perfect storm, if you will, for what we were dealing with. And brought into real question on this project, as it was originally conceived at least, whether it was prudent at this time. And before making that commitment to move the project forward, we decided not to at this time, to halt it before we actually secured the contractor, made the commitment there, and of course went to the bond financing. Obviously, this is a great disappointment for many of us. A huge amount of time and energy was spent on the project. But despite that kind of feeling of loss and a failure, certainly on my part, for not being able to bring this project to fruition, I want you to know this has been a wonderful experience. The Extension Education Center really started as an amazing vision by our citizens to improve our ability to serve the community with our educational programs. We had a creative, I thought was really a neat design, forward-thinking design, thanks to our architects and our support in the county, and a great team of people in the county. Certainly want you to know the great work that the facility staff, Jeff Jorgensen, Dan Robertson, Steve Blummer, did on our behalf. Folks in IT, procurement, county finance, and of course all of you at the Commissioner's office. So to all of you, I just want you to know that I really appreciate and I'm indebted to the opportunity to allow us to dream. And maybe at some time in the future, another time in another place, the Extension Education Center will come into vision. At least I sincerely hope so. So that's what I wanted to share, and I'm happy to answer any questions.
So I got a question. You sound like the project is dead, not on pause.
Well, pause, I guess, yes. I guess I'd like to explore maybe when you have more time to think about other things in COVID, what that future could look like. I'd like to think it's on pause. For me, it's dead. My time with Extension is over. My position there ends on June 30th, and I was anticipating staying on 1 day a week, 2 days a week, originally with Extension for the coming year to bring the project to completion, but obviously that won't happen now. But you know, we have great leadership in our Extension programs with our new regional director Angela Sandino, our new office manager Leah Sundquist. So really, the decision to go forward is really theirs and not mine. So that's how I look at it.
Well, Mike, I just want to say that you've been fantastic. You'll be missed. It is a great dream and great vision, and I hope someday it'll come true. My concern beyond losing you is that we are looking at a court, we're looking at childcare someday, and I guess I need a little feel for the future of the organization generally. And that might not be something you can answer, but it might be something we can talk about, where you guys go from here.
Yeah, no, I think that's really appropriate. And I know when Gary and I were together on May 1st and kind of, made this decision and wanted to bring this information to you, said, well, let's do 5-10 minutes with the commissioners right now, but let's try to set up something, in the future when you have a little more time so we can maybe address that question, Jim.
Okay.
I certainly have my ideas, but I think we really do need to bring Leah and Angela into this conversation. This is a time to reset and rethink. None of us know kind of what the next 6 months or year is going to be and how our world is going to change and how we're going to do business maybe a little differently. I think that group of folks really need to set the new vision. I really do know there needs to be a new facility somewhere, someplace. We just need to figure out what really is most appropriate now. And I might just say, and part of this decision really is predicated on the idea of making sure that the most critical thing is keeping the district, the Extension and 4-H Service District, intact financially, not overburdening ourselves with debt service so that we can't provide the important services to the community, even if we have to do it out of the trunk of our vehicles.
I see Paul and then Martha.
Yeah, just real quickly, Mike, thanks for your hard work, and we'll miss you. I just want to clarify and what Jim was kind of leading to, and maybe just pose it a little bit differently. If the bidding environment turns around substantially and is favorable, this project could be right back on track.
Yeah, within some range of question. Obviously, we still need to work with the City of Oregon City and see what would need to be done in terms of extending approvals and or the permitting process. I haven't been there yet. But the short answer to that question is very much so in my mind, if you're willing to hold on to that site and just see where the next 6 months or so goes. Yeah, we kind of wonder what it would look like if you go back out and rebid it. That could be good or bad. We don't know what's going to happen to construction prices. We don't know what's going to happen to financing. So there's a lot of unknowns there, but I'd like to think that it's still a distinct possibility.
Okay, Martha.
Again, I thought it was a cool vision and building.
I just want to thank you, Mike, because this has been a dream since 2003. It's been a long.
You were at that table, Martha.
Pardon me? Yeah.
You were at that table, you
at that
and Jim and
table.
Paul, all three of you. Yeah.
Way back when. And I, for one, won't be willing to give it up long term.
Yeah.
So you'll probably get, pardon me?
I was going to say, I don't think anyone in Extension wants to either, really.
Yeah, so we'll just keep working and we'll see what time the future brings. And hopefully, I still hope we can bring this to fruition, because Extension is a huge piece of what we do in this county, because, you know, most of our county is rural, actually, believe it or not. And I just have enjoyed working with you through the years. We're really going to miss you. I hope you can still enjoy your retirement in the middle of the pandemic. Who'd have thought, right?
Well, yeah, I'm actually meeting with the college people today, because I'm going to probably wind up at NREC, at least part-time down here for the next year while we transition that group. So I'm not leaving the community. And,
okay, well, we'll come visit you there in social distance then, okay?
Thank you, Mike.
Thanks for everything, Mike.
Ken, did you want some?
Yes, a couple of things. One, Mike, I really want to thank you for your friendship and the education you provided me about what is done here in Clackamas County and in the region on farming. It was very interesting, and I really appreciated that. I want to encourage you, keep the money in the bank. This project, it may be delayed, but it ain't dead, so don't spend the money.
Yeah, no, and I appreciate that, and I want you to know that is definitely the plan.
Good.
We've invested a lot of time and energy to get this far, and we're close. But I think we'll build on that. Hopefully, reserve, and we aren't going to spend it. You're right. And I would say, Ken, it's still the vision, all wood, CLT. We're
Yes.
still there.
I appreciate that.
Well, thank you again, Mike, and we'll see you down at NRAC.
Okay, yeah, we'll do a tour one of these days for you as soon as we can put that together.
All right, thank you,
We'll
Mike.
schedule a policy session, Mike, for you to come back with Leah to talk to the board.
That would be great. I know Leah and Angela would really like that.
Great, thank you.
Thank you.
Commissioners, I propose we break for now. We can continue this later in the afternoon, and your policy sessions start at 1:30 today.
All right. We're done.
Okay.
Thank you.
Thank you.